There are a number of values, mostly lab values, sometimes other measurements, that are given to people, and you're told something like it's okay, or we'll watch it, or some other silly kind of advice, when in reality, that measure is packed with all sorts of useful information that if it was conveyed to you, you would take better control over your health in your future. One such measure is this common value, this lab value, blood value, hemoglobin A1c. It is packed with useful, empowering information, but it's typically not passed on to you. The doctor may say something like, your hemoglobin A1c of 5.7% is borderline pre-diabetic. We'll watch it. And that's the full extent of the conversation. Or your hemoglobin A1c of 5.4% is okay because it's in the normal range. No, it's not. It may be in the normal range quoted by the laboratory, but it still predicts bad things in your future that you're not told. So let's talk about all the wonderful information, the secrets hidden in this very common measure called hemoglobin A1c. Given all the information is kind of like being given a map to tell you where you're going. You know the side routes, you know the detours, you know the way to get to your destination. So why isn't this information given to you? Well, one, the time constraints that doctors operate in. Two, sadly, they often don't care. They're indifferent to the information that goes beyond their obligation just to treat the acute situation and limit their liability. So there's a ton of information simply not passed on to you for a variety of reasons. So I call this talk The Secrets Hidden in Your Hemoglobin A1c, Index of Glycation, and the Rate of Aging. So let's talk about what is this thing called hemoglobin A1c? What are the health consequences of that value? What's an ideal value? Can you just listen to what the laboratory says or what your doctor says? And how to achieve an ideal value. So what exactly is hemoglobin A1c? Well, in each red blood cell in your bloodstream, there's about 35% of the protein by weight is this protein called hemoglobin, a large complex protein consisting of 4 subunits. And its primary role, its primary job, is to bind oxygen, deliver it from your lungs after the work of breathing, and deliver it to the various organs of your body, a very essential function. But hemoglobin can be modified by exposure to sugars, and it's the tail end, the so-called N-terminal valine amino acid that is subject to a change, to reaction with sugars, whether it's glucose or fructose or ribose. These 3 sugars react with that end of the hemoglobin molecule and change its behavior. And the hemoglobin A1c is now adding to clotting and viscosity, thickness of the blood. It leads to endothelial dysfunction and endothelial injury. And all that means is the lining of arteries is prone to injury, and that's the initiating process in developing atherosclerosis, heart attacks, and stroke. And hemoglobin A1c adds to it. It both injures the artery wall and promotes blood clotting. So you can imagine this is a player in a lot of conditions like stroke and heart attack. Now, red blood cells live and die over about 90 days. So while this reaction of sugars with the end of the hemoglobin molecule is irreversible, red blood cells themselves, not the hemoglobin, but the red blood cells themselves containing hemoglobin, turn over about every 90 days. So while the glycation reaction per se is irreversible, because of the turnover of red blood cells, the hemoglobin A1c essentially gives you a 90-day reading on how much sugar has been reacting with your hemoglobin. Now, all proteins are subject to glycation, not just hemoglobin, albumin, another blood protein, insulin. When insulin becomes glycated, it makes it less efficient, less effective at allowing blood glucose to enter cells, so it adds to insulin resistance, the fundamental process that leads to abdominal fat expansion, type 2 diabetes, and other problems. Antibodies, or immunoglobulins, are also glycation prone, making them less effective in protecting you from invading microbes. Low-density lipoproteins, not LDL cholesterol, but low-density lipoproteins, or LDL particles. They're very prone to glycation, about 8-fold more prone, and when LDL particles become glycated, they're much more likely to add to coronary disease. So glycation of LDL particles is a very critical process in leading you to heart disease. Fibrinogen, a clotting protein, its action is impaired in the presence of glycation when fibrinogen itself becomes glycated. DNA can become glycated, and it encourages the development of mutations that can lead over time to cancers. Proteins that protect you from bacteria, such as lactoferrin and lysozyme, also prone to glycation, making them less effective in protecting you from bacteria. And antioxidative enzymes are also prone to glycation, making you more prone to the effects of oxidation. And very importantly, collagen, the most plentiful protein in the body, richest in skin and in joints. Collagen is very prone to glycation. And when collagen becomes glycated, it becomes brittle and then fragments and is reabsorbed. Over time, if that happens in a dermal layer of skin, it thins your skin, leading to wrinkles and a crepey texture. In joints, it means loss of collagen in cartilage and erosion of cartilage over time and eventually bone-on-bone arthritis. So loss of collagen via glycation is very important in aging as well as numerous health conditions. So in general, we don't want our proteins to be glycated. We want to have glycation to proceed at the lowest and slowest rate possible. So hemoglobin A1c is a gauge of the rate of ongoing glycation in all body proteins. It's one protein, of course, but it reflects the level of glycation in all proteins. Now, conventional cutoffs are misleading. So people will tell you that a hemoglobin A1c of 6.5% or greater is designated semi-arbitrarily as type 2 diabetes. 5.7% is prediabetes. That is, of all the hemoglobin in your red blood cells, 5.7% have undergone glycation, a reaction with sugars. In conventional thinking, 5.7% or less is normal, and the American Heart Association says that any level of 7 or less is desirable. I'd like you to cross those values out. Yeah, they may be the conventional cutoffs, but they mislead you into thinking, for instance, that a level of 5.5% is therefore healthy. It's not. Here's a series of studies taking a look at this. In this study, they only went as low as 5.4%, but you can see, even in the low 5 range, there's a curve going upward, showing there's an increase in cardiovascular events. Here's another study. I'm sorry it's hard to see, but across the yellow, that's men, the risk of cardiovascular events as hemoglobin A1c goes higher and higher. You can see at the top, less than 5%, 5% to 5.4%, 5.5 to 5.9%, and so on. And with each jump up in hemoglobin A1c, you can see there's an increase in the risk for cardiovascular events, such that at a hemoglobin A1c of 5.5 to 5.9%, that many doctors say is okay, or you're not yet pre-diabetic, or we'll watch it if it is in the pre-diabetic range above 5.7%. You can see that cardiovascular risk is doubled already. And at a level of 6.5%, it's tripled. Likewise in women, though not quite as marked, as we go up higher in hemoglobin A1c, the risk for cardiovascular events begins to increase at about 5.5% in this case, not so severe as in men. Nonetheless, this idea that 5.7% or any value up to 5.7% is allowable and healthy is simply not true. Another perspective, in a Canadian study of 600,000 participants, you can see that the increment in risk begins at around 5.0%, especially in men. So this idea that 5.7% is borderline or 5.5% is okay is simply not true. Another perspective, in this case, once again, 36,000 men and women watched over 10 years, and you can see that at a hemoglobin A1c at 5%, marked as 30 millimolar by the yellow, you can see that the curve increases sharply after 30 or after 5.0%, but there's even an increase, an incline in the risk below 5%. So increase in risk from this value on cardiovascular events begins below 5.0%. So this idea that it takes 5.7% to be concerned is nonsense. You should be concerned and take action well below that value. Now, the reason why some physicians say that getting a lower hemoglobin A1c, especially below 6%, is dangerous is because there are several large studies in people with established type 2 diabetes on typically multiple medications, insulin, other drugs, oral and injectable. While there's an increase in events as hemoglobin A1c increases above 6%, you can see that there's an increase in events also below 6%, a so-called U-shaped curve. But that's in type 2 diabetics on multiple medications. In people who are non-diabetic, there is no such increase in risk at lower levels of hemoglobin A1c. Unfortunately, some of my colleagues have interpreted that to mean that everybody should have a hemoglobin A1c of no lower than 6%. Of course, that is complete nonsense. You want your hemoglobin A1c as a non-diabetic or as an emergent future non-diabetic to have a hemoglobin A1c well below 6.0%, and you do not experience an increase in cardiovascular events once you're off insulin and diabetes drugs. So think of hemoglobin A1c as a gauge or index of the potential for numerous health conditions. It's a kind of a broad indicator, what I call an Uber indicator, of insulin resistance. The higher the hemoglobin A1c, the poorer your body responds to insulin. Muscle, brain, liver don't respond, and your pancreas compensates by producing huge amounts of insulin, 10-fold more, 30-fold more, 100-fold more. And those high levels of insulin cause your abdominal fat to expand. It leads to dementia, risk for breast cancer, heart disease, etc. So having insulin resistance and thereby very high levels of insulin in your bloodstream is not a good thing. And you can use hemoglobin A1c as an indicator, an indirect indicator of that insulin resistance. Having a higher hemoglobin A1c means that your liver has been engaging in a process in which it converts carbohydrates and sugars, like those from grains and sugars, into triglycerides. So you'll see higher triglycerides when hemoglobin A1c is higher, let's say 5.5 or 5.6%. You're likely to see also higher triglycerides. Why is that important? Because triglycerides can't float freely in the bloodstream. They must be coupled to a particle called very low density lipoprotein, that is triglyceride rich. VLDL particles are themselves a cause for heart disease because they add to the accumulation of coronary atherosclerotic plaque, and the VLDL particle, rich in triglycerides, interacts with LDL particles and helps make them become small and more glycation prone, and thereby much more potent causes of heart disease. So a high-ish hemoglobin A1c can tell you that you're engaging in this process of liver de novo lipogenesis, making more triglycerides. That in turn leads to more VLDL particles. And so small glycation-prone LDL, the worst particle of all that causes heart disease, is made worse and is indicated by hemoglobin A1c. Higher levels of hemoglobin A1c are also associated with hypertension, fatty liver, accumulation of abdominal fat, and an increase in blood clotting events. In other words, it's not just about blood glucose or risk for diabetes or where you are in the pre-diabetic spectrum. It's about a whole constellation of abnormalities. It tells you that bad things are going on that can lead to other conditions and increased inflammation and an impaired immune response. So don't look at hemoglobin A1c as just a blood sugar indicator. It's an indicator of numerous processes. And of course, if your hemoglobin A1c is high-ish, 5.3%, 5.5%, you are accelerating the deterioration and loss of collagen, especially in skin, joints, and brain. So look at hemoglobin A1c as an ongoing gauge of how fast you are aging and how fast your health is deteriorating. So we're going to aim for an ideal hemoglobin A1c, which is no higher than 5.0%. But let's ask, is it accurate? Well, several things to consider in deciding whether your value is accurate. It can be non-fasting, does not have to be fasting. Caucasian populations tend to have a lower level even when adjusted to the blood glucose. A recent blood transfusion can both increase or decrease, so you want to wait till after blood transfusion, a minimum of 4 weeks, ideally even longer. Having any kind of anemia falsely increases, so the value may be higher than it should be. You need to repeat that when the anemia is corrected. Alcohol exposure also falsely increases it. Vitamin C can go either way. Pregnancy falsely decreases. The key here is to, if any of these situations apply to you, get beyond that situation, then repeat it. no sooner than 4 weeks, more likely 8 to 12 weeks after the situation has been corrected or you delivered a child or get off vitamin C. And then, of course, there are hemoglobin variants, genetically determined variants. Those determine how accurate your hemoglobin A1c, and sometimes you can't use it at all. That is, the hemoglobin A1c is so inaccurate you can't rely on it. That only happens on occasion. If that's true for you, you can always just use either fingerstick glucoses or continuous glucose monitor to get the real values. So what reduces this process of glycation and thereby hemoglobin A1c? Well, you stop eating foods that provoke a rise in glucose, so sugars and carbohydrates. The worst carbohydrate of all, of course, is wheat and grains. You can follow something I call the blood glucose no change rule. You'll need a fingerstick blood glucose device or a continuous glucose monitor to do this, but it means checking your blood glucose just prior to the start of a meal. So let's say you're going to have dinner. You check your blood glucose just before dinner. Let's say it's 100 milligrams. You have your dinner, then watch over 30 to 60 minutes after the start of dinner. That's different from the conventional advice to check your blood glucose 2 hours later, but that's the rule to follow if you're on insulin and diabetes drugs to see if your blood glucose returns to its baseline. We're not concerned about that. We want to know where the peak, the highest blood glucose is after you start eating. And we want no change compared to the prior to meal value. So if you're at 100 at the start, you want no higher than 100 milligrams at 30 to 60 minutes. If it does go higher, say 150, there's something wrong with your diet. You need to look back at that meal and identify the culprit. It will be carbohydrate. And next time, reduce portion size or eliminate it so that you don't experience that rise again. You want no change. Now, we have to accept that these devices, whether it's a conventional fingerstick device or a continuous glucose monitor, are accurate to about plus or minus 10 milligrams. So that if you have 100 and the value goes up to 108, that's essentially no change, okay? Because the range for the value of 100 milligrams is really 90 to 110. So they're not perfect. These devices are not perfect. They are better than they used to be, but keep that in mind and don't fret over small changes. Restoring nutrients that are largely lacking, that when restored, synergize to minimize insulin resistance and thereby reduce blood glucose and over time reduces long-term measure of glucose, hemoglobin A1c. The most important, vitamin D, magnesium, iodine, and omega-3 fatty acids. Restore those things absent or lacking in the modern diet, and you'll see hemoglobin A1c slowly, because it's so slow to act because of its 90-day life, it responds slowly. So vitamin D, typically we use a dose that generates a 25-hydroxy vitamin D blood level of 60 to 70 nanograms per milliliter, typically a dose of about 5 to 6,000 units per day in oil-based gel cap. Magnesium, we use salts of magnesium like magnesium malate, magnesium glycinate, magnesium chelate, and some others to provide about 400 to 500 or so in that neighborhood elemental magnesium per day. Iodine, we use kelp tablets, mixed forms of iodine, or potassium iodide drops, and we try to get around 350 to 400 micrograms per day of iodine, more than the recommended daily allowance. But what is more in line with, I think, is the ideal intake to optimize thyroid hormone performance. And then omega-3 fatty acids, EPA and DHA, I generally recommend a minimum of 3,000 milligrams of the combination of EPA and DHA per day or more, because that's the intake sufficient to raise the measurement RBC omega-3 index, a common test for the adequacy of omega-3s, to 10% or greater, the level at which you've maximized benefits on reducing cardiovascular events, facilitating reversal or regression of coronary atherosclerotic plaque, and minimize your potential for cognitive impairment. An RBC omega-3 index of 10% or greater, typically achieved by supplementing 3,000 to 3,600 milligrams of the combination of EPA and DHA per day. You may need to dose adjust that. The heavier you are, the higher the dose, and the thinner you are, the lower the dose. But in general, 3,000 to 3,600 milligrams per day of the combination of EPA and DHA. Reducing endotoxemia. If you don't know what that means, I invite you to dive into my conversations about SIBO, small intestinal bacterial overgrowth, which is epidemic now. And when the small intestine is invaded by fecal microbes from the colon, they release some of their toxins into the bloodstream. That's called endotoxemia. And that drives up insulin resistance, blood glucose, and your hemoglobin A1c. So that you address by addressing the SIBO, that thereby reduces the endotoxemia. It's actually quite easy. We use something called SIBO yogurt. That is not yogurt like the store. It looks and smells like yogurt, but it's not yogurt. It's a way to ferment microbes to achieve very high counts, choosing microbial species that colonize the small intestine and produce what are called bacteriocins, natural antibiotics in killing off those invading fecal microbes. We're going to reshape body composition to achieve a reduction in abdominal fat, because it's abdominal fat that generates insulin resistance, higher blood glucose, and higher hemoglobin A1c. We're also going to restore youthful muscle, not by going to the gym every day, but by restoring factors lacking in your life that help build or restore youthful muscle. Don't worry, you're not going to be a bodybuilder kind of body. I'm talking about the amount of musculature you had in your 20s and 30s. And we're going to restore Lactobacillus rhodori, this microbe lost by nearly everyone because of its susceptibility to common antibiotics. And when you restore rhodori, it colonizes the small intestine and takes up residence and produces those bacteriocins I mentioned, natural antibiotics in killing off invading fecal microbes. And that achieves a reduction in endotoxemia and thereby a reduction in insulin resistance, a reduction in blood glucose, and then a reduction in hemoglobin A1c. Another microbe important for this effect is Lactobacillus gasseri. Like rhodori, it takes up residence in the small intestine and produces bacteriocins and thereby reduces endotoxemia, and it contributes to minimizing or reducing abdominal visceral fat. That is the source of much insulin resistance. There are other microbiome efforts you can make, especially fermented foods like sauerkraut, other fermented veggies, kimchi, kefirs. Very helpful in, over the long term, reducing your hemoglobin A1c, and including fibers, so-called prebiotic fibers, that are metabolized by microbes in the GI tract. When you get fibers like inulin, fructooligosaccharides, galactooligosaccharides from legumes like black beans, white beans, and chickpeas, you further reduce glucose, insulin resistance, and thereby hemoglobin A1c. Collagen peptides and hyaluronic acid. These are two factors largely absent from the modern diet because of the awful advice we've been given to cut saturated fat and cholesterol that cause most modern people to abandon the consumption of organ meats like brain and skin and tongue and heart. Well, that means the modern diet is woefully deficient in collagen peptides and hyaluronic acid, two things that achieve dramatic improvements in your shape and body composition, including a reduction in abdominal visceral fat, the source of insulin resistance, and an increase in muscle and a reduction in endotoxemia. So those two simple things, now you can get them back in your diet by consuming lots of organ meat, but most modern people are too squeamish to do that anymore. And so you can do this with supplements, most commonly bovine-sourced collagen peptides, 10 to 20 grams per day, preferably 20 grams per day. Hyaluronic acid that you can source as a supplement. It's kind of a commodity product. 120 milligrams once per day is the typical dose. And then carotenoids. The modern diet that is over-reliant on processed and ultra-processed and fast food is almost devoid of carotenoids. The best sources are such things as kale, spinach, broccoli, other brightly colored vegetables. But people don't get those things like squash as much as they should, or kale, or dandelion greens. And so we're going to focus on one, astaxanthin, because it's the most potent of all carotenoids, though there are others that are very interesting and helpful also, like cryptoxanthin, lutein, zeaxanthin, and lycopene. But the increase in carotenoid intake, including supplementing astaxanthin, such as 4 milligrams per day, helps further reduce abdominal fat, thereby increasing fat mobilization and reducing reliance on liver glycogen, process that thereby further reduce blood glucose and insulin resistance and help shrink your waistline by getting rid of abdominal visceral fat. And all that put together reduces hemoglobin A1c. So there you go. Hemoglobin A1c, often regarded as nothing more than an index of your blood glucose, that even when abnormal, you're told either you'll be put on medication, or they'll watch it, or your value of 5.5% you were told was okay. It's not okay. And so there you go. You have this wonderful index of the rate of aging, the rate of glycation, and what you can do about it.